Christian. And I'm excited to learn about this. She sent us the abstract that we sent out to you folks as well. And I was really intrigued by what she had been working on. And Catherine also is someone who teaches for us in our Master of Science in Nonprofit Management Leadership program, as well as our graduate certificate in nonprofit management. She's teaching our intro course, and this is our first semester doing that. So we've been enjoying working with her on that. I'm going to turn it over to Catherine and let her introduce what it is she's going to be talking about with her research, and to also tell you a little bit more about herself. And then at the end, we'll have a chance to answer any questions, or she'll have a chance to answer any questions that you might have, as well as answer any questions that you folks might have about what we do at HBI. So with that, I'm going to turn it over to Catherine.
Well, thank you for having me, and I am looking forward to participating with each of you today. Yes, I'm excited to share some of my research. I think you spend so much time in the weeds of it. It's nice to be able to connect with other people about some of the things that were findings that were seen throughout the research. I am Catherine Draeger Pederson. After 16 years of being executive director of 3 different nonprofits here in the Metro Milwaukee area, about 2 years ago, I started consulting full-time. Was also in the midst of my PhD research and work at that time, but am really glad to be here. Really glad to be in this work. Some of the nonprofits that I worked with, I'll touch on today throughout the presentation, and how they affected really the questions behind the questions in this research. Why would somebody choose to spend significant time and energy on some work, and where it is going from there. So as I look at some of the people who are participating today, it's a lot of really good friends and colleagues, and then several people that I do not know well, or at all by name. So excited for that. I did just graduate in May with my doctorate. So at this point, I'm beginning to share this information out into the world. And so you are one of the very first presentations that I'll be giving of this research. So I think with that, I will get started, and I will periodically check into the chat. But if not, at the end, we will have a lot of time for questions and answers to discuss. Really, I would love to get your input in discussing the findings and how you see that these could be relevant in the work that we do. So the title of my dissertation was Moving Beyond Transactions, a qualitative look at the characteristics of transformational relationships leveraged by nonprofit staff in their work in the community. There we go. So the background of this was I really felt that there was a mismatch between so much of how we share our work being transactional in the nonprofit world. How many people are served, how many people showed up. All of those things are good and dandy, and we need people to show up. We need people to be served. But there's a mismatch between just a transactional encounter with the individuals that we served and the transformational work that really needs to take place for this work to make a real impact in the community. Rarely does a problem exist in isolation. And so our outcomes-based measurements that we often use are really not, they don't encompass all of the work that is happening. And especially when we're looking at things that happen with like generational poverty, or things that, if you're a food pantry, you might bring them food, but they really need housing and other resources. So you're just one piece of a bigger puzzle in the transformation of their life. And one of these examples is Brian here. When I worked at Freedom's Community Ministries, and Brian has given me permission to share this story publicly. When Brian came to the food pantry, he was there. He probably started volunteering there before I started my work there, but he was a regular. He was there every single Saturday morning. Now, he also came for food most of those times. So he was both a community member receiving food, but also one of our core volunteers at the pantry. And after years of being there, one day he came to me and he had this crumpled sheet of paper and he's like, "Can you sign this?" And I'm like, "Well, what am I signing?" And he's like, "Well, can you sign it saying that I volunteer here?" And I read it and it says, "Does this person volunteer?" And I'm like, "Yeah, you do. So I can sign this." So he takes it, and a couple weeks later, he comes like kind of not running, but sauntering down the hallway. And he's like, Catherine. And I'm like, "What?" And he goes, look at my teeth." And I'm like, "Okay." I still didn't quite get it. He's like, that sheet of paper you gave me, because of that, my caseworker was able to connect me with another resource. And I haven't been able to eat steak in 17 years. I didn't have enough teeth in my mouth to do so, enough healthy teeth. And that sheet of paper was a program through the city. There was going to be a dentist who would cover any out-of-pocket expenses that I would have after my insurance. So for me, it was $2,000. I haven't been able to get teeth because I didn't have the $2,000, and they paid that because I volunteered here. And I sat back and I just cried because I was like, I signed a sheet of paper. But the look on his face and the sparkle in his eye and the work that happened, that's like that, this is transforming his life. And it wasn't because he came to get food. It wasn't even just because he was a faithful volunteer, but it's because all these people invested in his life. And as I was trying to figure out how in a grant application or how to like share that impact, well, that was one person. 48,000 people were served that year. This is one person out of that 48,000. But for him, this work and the relationships and the work were transformational. And so I wanted to see if in that there could be some research to back up what that kind of work looks like out of those relationships. And so the two questions that I asked in the research was, what are the essential characteristics of transformational relationships in contrast to transactional encounters of staff and volunteers within nonprofit organizations? And two, how do staff and volunteers who engage in transformational relationships leverage their skills to improve the quality of their relationships with beneficiaries? So the questions, this is not saying that transactions are not important. It's saying, what are those things that go above and beyond that, that make this work transformational? And then how can those characteristics be leveraged to improve quality of operation and the relationship with beneficiaries or clients would be another word there. This, some of my work was really based on Lynn Benjamin's work. She's I believe, adjunct professor down at the Lilly School of Philanthropy. She's been studying this relationships and the benefit of relationships over the last 10 or so years. In some of her work that she did, she was looking at how nonprofits were being evaluated in their relationship with their funders. And in that research, one of the models that she became familiar with was this revised performance framework. It included, yes, both short-term outcomes that we're more used to reporting on: how many people are served, who showed up, what is the financial impact, how many students, what was the GPA improvement of the students. But in this research, she shared a story of how a nonprofit that she was observing said, but that doesn't capture all of what we do. We are really committed to raising up leaders in our community. But in raising leaders up in our community, what we have found is that our traditional outcomes have diminished. We're able to serve less people because we're spending so much more of our time and energy on equipping young leaders who aren't coming to us with previous education, who aren't coming to us with some of the same experiences. But it's part of our mission is to raise up community leaders. And so in doing so, they said, we wanted to add something. So we might be serving less people in our program, but we are building organizational capacity. And what was this organizational capacity? That is really where some of this work was grounded, is what are some of those things, if you're going to be saying we're doing this, what research is out there to say this is why doing this work on relationships is valid and beneficial. So I'm not going to go through all of the literature review and next couple slides talk about methodologies, except just to say that when looking at the literature, you know, one of the biggest things is there is little consensus on evaluation methods in the nonprofit field. The number one, like the most universal evaluation method is number of people served. And yet we know that, or we don't know, but literature is saying that that is not the most impactful data that can be evaluated. And so then looked into literature based on the nonprofit and funder relationships. Really wanted to do that because all of this research could be good and grand, but if foundations didn't find it beneficial, if funders didn't find it beneficial, then this work will never receive the funding it will need to continually moving forward. I then did look at moments in history. And when we look through the moments in history, really to get to current evaluation methods, there was 4 really pivotal points in history that have shaped our current evaluation methods. 100 years ago, evaluation was neighbor looking at neighbor. Most funding was so local that you knew if you gave money to somebody, it was helpful. I mean, this is where we have barn raisings. Like you literally help somebody build a barn. Well, as time changed and money started to shift away from just local, but to a little bit broader thing, there really wasn't evaluation in it. It was built on trust. So that changed about 50 years ago with our government. When actually staff at government agencies were starting to be evaluated on their work, they said, oh, if we're being evaluated on our work, it'd be helpful if we did that same thing to nonprofits that we are supplying money to. But most of those evaluations were built on how many phone calls did you make? How many people did you have a touch point with? They were very numbers based. That because it was really easy to measure and it was really nice to put into charts and move up the ladder. Then in the 90s, so that was government. In the 90s, United Way in 96 actually launched their national outcomes-based measurements that rolled out across the nation. One of the primary roles with that in the very beginning was that they had a unified way of sharing data throughout the whole United States. So not to say it was simplified, but it was, it didn't encompass all aspects of the evaluation. Then when it came to individuals, 9/11 was the pivotal moment where individuals were looking at, hey, I gave money to what I thought was going to one thing, and now my trust is starting to look in, like, how is that money being spent? And so those were some of the defining moments in history throughout the literature that really shifted nonprofit evaluation. A few other things in there was that one of the current problems that kept getting brought up was that being scared to lose numbers thwarted creativity and risk taking. Because if you knew you could get a certain amount of numbers with your current practices, but you were unsure of a new initiative, people were scared to take initiative. And so then I looked at what could have been some of the possible characteristics of people-centered relationships that came up in the research. I had not done the research yet, so it was just to kind of put it into base. And then one of the questions that was asked early on in the process is, would this be faith-based or not faith-based? Like, would there make a difference in that? So while that is a very minor topic throughout the study, it was recognized and so studied. I think there's 2 questions here, so let me make sure I'm answering it. What is the researcher's working definition of transformational? Really good question. Actually, part of the research was on defining it, and one of our last slides will be on the definition of not just transformational, but transformational relationships that's based in this study. And yeah, like there's definitely new evaluations methods that are coming up, such as the public health evaluation method. What is nice is we're just living at a time where probably in the last 10 years is what the literature says, that there's additional evaluation methods that are being researched and being brought forward. So with this, briefly through the methodology, it was a qualitative study. I purposeful sampled 6 foundation staff that were convenient to me. They recommended the nonprofit staff that I interviewed. So that was based on reputational sampling. And so there ended up being 6 foundation staff and 20 nonprofit staff that agreed to participate. The interviews were over 6 months in 2020, and the data analysis was over 4 months at the end of the year. When I did analysis, I did a lot with qualitative, going back into the data. There ended up being over 300 pages of data from the 26 different interviews. And so it was a process of reading, reflecting, exploring. I did it through hand coding and Post-it notes, bringing things into like-minded groups. I then took those Post-it notes and put them into a chart. And these were the different characteristics on the top. If something was a heavy part of conversation, it was green. If it was slightly mentioned, it was yellow. If there was no mention at all, it was red. So this helped further condense the different themes. And then after all of that, this is the theoretical framework that was developed on transformational relationships, moving beyond transactions into a sacred space. And so with that, people will ask me, what is the most surprising thing in the data? It really comes to this slide was that I came into this work to study individual characteristics. But when looking at all the data, individual characteristics were intertwined with the service model of the organization and the environment that the organization created. And so we're going to break each of these apart, but it was a little bit surprising for me. I mean, even the research questions that I asked, they were based on what are the characteristics that you are looking for in people that you want to hire, what are some things that you do in your organization that moves beyond transactions, and what are some things that you report on with funders in your work. And so expecting that, but these other ones were evident. Now, of the 20 people that I interviewed, when I talked to the foundations, I said, anyone at the nonprofit that you want me to speak with, volunteer staff, whoever you think would be a good example of this, let me know and I will reach out to them. But in all cases, they were upper management nonprofit leaders. And so they were not all CEOs, but they were in more executive types of positions, realizing afterwards that was a bias of the data collection, because if you're talking to a foundation, the person they're connected with is typically one of the leaders of the organization. And so there should be, one of the things that'll come later is there should be more research, is to what would it look like if somebody had the individual characteristics but wasn't in the environment created from the organization, or vice versa? Could a nonprofit function this way in their service model and environment created, but the individuals they hire don't encompass all these characteristics? That would be some really good studies, because honestly, I can't delineate that from this study. And the last thing was, a fourth was really, what was this connecting to funding? And so looking at it, why moving beyond organizations, or moving organizations beyond transactions into a sacred space? Why the word sacred space? Actually, that came from one of my interviews. So I'd like to read one of the excerpts. We don't often appreciate the vulnerability that it takes to come forward, and the courage it takes to come forward when you're not, seeking food or shelter or therapy or help. And because we live in it, we work in human service field that denies our own humanity. We sometimes aren't connected to the humanity in other people. And it's really important for us to understand and appreciate that vulnerability in others and in ourselves. I think that's what makes it sacred. It's a privilege to help people who are struggling. It's really a privilege to do the work that we do. It's also what I mean by sacred. I don't really mean holy like a religious term, but it's sacred in that it demands, like I said, the vulnerability of both people coming together for the exchange of something. And this, how can I be of service to you instead of lifting you up? So this is an equal exchange. I think that's what makes it sacred between someone who's working in the field and someone who needs help. Right. It's a recognition of your autonomy and your self-determination and your sovereignty as a person when I treat the exchange between us as sacred. So that's really where that brought together so many of the themes of the individual characteristics, the service model, and the environment created. And so as we look into the individual characteristics, like I said, this is what I assumed I would study in this research, is what are those things that people who move beyond transactions do in their work. When I ask the questions also in the interviews, not everyone is just going to say, well, I have deep concern or I am teachable. And so asked words around that about how they would deal with certain circumstances. And these are the things that came forward. The three main themes were open and engaged relationships, having an open presence, and open communication. And so again, because you're not really here to hear just from me, we're here to learn from the 26 people I've interviewed. One of the staff who actually has worked both in nonprofit and foundation space is you really need to build strong relationships, because transformational leadership is really what it's about. It's about listening, and it's about building trust and relationships with your stakeholders. And another nonprofit staff that I talked with, she mentioned a quote from Mother Teresa, who says that the trouble in our world is that we draw the circle of our family too small. It was this concept of that to get out of poverty is a relationship away from poverty, and we need to be out of that thing is that we need to build these larger relationships. And so in that is engaged relationships, deep concern, supportive, and trustworthy. When we went to open presence, and so one of the interviews said, nobody's ever done growing or improving. There's always a next step. And somebody else looked into the compassion. One of the male nonprofit leaders that I interviewed, he said, humanity is like the hinge that opens the floor on how much success we're going to have. And if humility, it's just not there, that door, it gets stuck. We don't take the time to stop and listen and just ask how we can help each other. And so, some of these are pretty famous by Dr. Brene Brown, the vulnerability and authenticity. These are not new concepts, but looking how it works all together in scope with being teachable, compassionate, and humble. The last one that was here was open communication, that there was this sense of being available to listen, to have healthy disagreement, and even a little bit of humor was built in there. One of the interviewees mentioned David Asperger's quote that says, "For most people, feeling heard is so close to feeling loved that the two are indistinguishable." Another one said in their client surveys, when they asked what their favorite part of a visit, a very few of them said it was the services or materials. Almost everyone said that they were listened to and that someone cared for them, someone prayed for them, and that kind of thing. And so that communication and just being there to listen was so key. When it then came down to the service model, some of these characteristics were organizationally, such as the missions model, where people wanted to be connected to something bigger than themselves. Or another interviewee mentioned Margaret Mead's quote, "Never doubt a small group of people, of committed people, never doubt that a small group of committed people can change the world. Indeed, it's the only thing that ever has." And so this mission model was core to all the conversations that were had or interviews that were had, but it also went into individuals. So the people that I interviewed, they were all thought leaders in the innovation of tomorrow, thinking about new ideas and really being invested in the work and ways to improve. For 16 out of the 20 people that I interviewed, they had a personal connection to the nonprofit they worked with. And so one of them, and pardon the language, but I am quoting, they said that the way that I was treated on welfare pissed me off, and I decided that I wanted to do something about it. So that was, much of the motivation behind what they did in their service model. And then the last one was guided by faith. It was interesting. I didn't know where this would go in the data, but there was a sense of not all the people that I interviewed had like a personal connection to faith, but they all talked about something that guided them outside of themselves. And so this definition of faith is very broad, and not into a religious terms, but that there was something that they were seeking justice and fairness and dignity, but because of this burning desire. For some was a traditional faith-based, but for many of them, it was just a feeling in their gut, in their just heart, in their service. The last one here, well, the second to last one, but the last one of the characteristics is the environment created. Again, none of these things are shocking, but it would be really interesting to evaluate nonprofits based on some of these things. So are they spending time creating a welcoming environment? More than one interview that took place, they talked about, how are we going to talk to, an individual who needs housing and their needs for case management if they're starving right now? Like, they're not going to be able to cognitively be with us in those conversations. And so making sure that there's something available, that there, a lot of the individuals talked about, being very intentional and going to great lengths about creating a welcoming space, both physically and emotionally, in how the space was created. The second one here of dignity and respect, this started to come up in conversations before, or in my early interviews, but one of the things that I have to recognize in the research is that the racial pandemic happened right in the middle of my interviews. And so it was very top of mind at the time of the interviews. It was, we had the protests that were happening, the prayer walks, and many of the people that I interviewed were very much engaged with those. And so understanding that I will never know how much this would have been mentioned at another time of history, but it was evident in there. One of the interviewees said that there's dignity issues that are embedded in the transactional mind that is in impending progress for the community overall. Another one said that they wanted to treat people as a gift. And maybe some of that places that are less healthy would have like those places that are less healthy have a narrow scope. Another one said that so many people are stripped of their dignity when they come into the nonprofit. And so it's their responsibility to give people dignity back when they feel like it's been taken from them. And so then we also looked at partnership. Most of these leaders talked about partnering with other organizations. They were very cognizant that they did their thing very well, but they were not the end all be all of that. And they really wanted to make sure, and this goes into autonomy, they really wanted to make sure that people were not becoming dependent on them. And so in that, some of those things that came through was allowing people to make their own decisions, to be autonomous, that there was this strong belief upon the leaders that the people that they were working with were very capable of making their own decisions. And they worked from this like strength-based model. The last thing here, what on the creating a welcoming space, was literally just being available. There was this like being available, being flexible, but with some boundaries. One of the interviews that was worked in the schools, he said the rate limiting factor for young men getting healthy, I think it's time with adults. It's not money right now. And so another one said that they planned their whole schedule throughout the day to allow for flexibility. They did not allow their staff to fill every moment of every day because they didn't know what was coming through the door. And they wanted to make sure that they were always available for the person coming in the door. So last thing here, that really isn't individual characteristics, but I was looking at how is this all connected to funding? That relationship between transactional and transformational. One of the quotes that was actually given by a foundation is that if 1,000 people show up at an event, but at the end of the day, the 1,000 people go home, what change really happened in the community? And they really questioned that. And when they looked at how they were evaluating nonprofits. In assessment, one of the foundation staff said, there's a lot of nonprofits out there doing really valuable work, but I want to be able to differentiate between the average work and the work that deserves to be supported. In the conversations with foundations, there was a lot of mention about exploring additional ways to be measuring nonprofits, but there was little consensus that mirrored the literature. And there was one story about how an organization was working with one individual over 9 months and how many people had to get involved for that one individual to get the support that they needed. They had police involved, school involved, social workers involved, family involved. At the end of the day, it was a good story, but she was actually talking to a foundation. She said, how would you like me to write this up? You know, we did hundreds of hours between all of our volunteers invested, but it was one person. You know, that doesn't look fancy in a report. But this last thing in the relationship that was really powerful, I've been thinking about it over and over since then, is that foundations really want their relationship with their nonprofit in a similar way that they want their nonprofit to have relationships with the community. And so that was really helpful piece of knowledge in there. So just that you know, with this, my dissertation has been published. I have 100 pages of interviews in the dissertation. And so if there's any one of these specific areas that you're looking for more examples or how this could be, you know, we have 1 hour, including question and answer today, and can't possibly go through them all. But it also then, in the research, looked at some of the implications about how can nonprofits improve their operations, how can they build their staff capacity, looking at implications, and these implications were based on the interviews and what they did, but for foundations, can they fund exploration of different evaluation methods? What can they expect from the nonprofits in which they serve? And can they fund additional research? And then, you know, really implications for leadership. This is the last point here, but how can nonprofit effectiveness and evaluation change if more nonprofit staff and volunteers were deeply engaged with the findings of this research? And so asked earlier, you know, where did this come from? And based on this research and this literature review, came to a working definition, which I am sure will continually be molded and shaped with additional research. But moving organizations beyond transactions into a sacred space, transformational relationships are the intersection between individuals who are engaged in open engaged relationships, open presence, and open communication, in an environment which is welcoming, filled with dignity and respect, where staff and volunteers are available, and with a mission model that supports thought leaders who have a focus on transformational change in the community. There's lots of additional research in this. This is a small piece of a bigger puzzle. Looking at isolating those various variables that I had mentioned earlier, focusing on each thing. There's no ranking of this. You know, there is in the in that original chart, I said things that were red, green, and yellow, but I didn't bring these characteristics in front of the nonprofit individuals I was interviewing and saying, of these, which do you find is, you know, most impactful? Like, this research does not do that, but that would be a good next step with it. One of the other things that was brought up is there's no negative effects that were mentioned in this research. And yet, you know, there was no talk about being engaged in this relationships. Is there burnout? Is there secondary trauma? Other things that would come up. And so that's definitely something that should be looked into to be engaged in transformational relationships in a healthy way. We also did not interview beneficiaries or community members and see, how do you feel you're being treated in this work? There could be quantitative studies to look at that, the impact on clients, and just the last one here is just how to evaluate. So we have these characteristics, so what? You know, what can be done with them next? So that's really the work I've been engaged in. Looked at, really tried in this, understanding that I had 16 years of nonprofit experience. You know, there's always some bias into it. It was really helpful that I did not choose the people that I interviewed for the nonprofits, that I did not choose people that I thought were doing good work, but that a secondary source, you know, enjoyed the work that they did and thought they were worth being interviewed. And so at this point, I would love to open it up for questions. You are welcome to ask questions in chat, or better yet, everyone is tired of listening to me for the last 40 minutes. And so, you know, be audible and turn on your mic and ask a question out loud.
Presentation, maybe people have easier chance of seeing each other.
Yeah, I will do that. So
thank you.
Yeah, feel free to put, you know, the rest of this is meant to be a conversation. it would be so amazing if we were in the same room together and communicating, but
I have a quick question, Catherine. I had to run,
absolutely.
my daughter's home sick today, so I had to run and grab something at the beginning of your presentation. Tell me the length of time that this was carried out, this work.
So the interviews were carried out over just about 6 months, and the analysis for about four months after that.
Great, thank you.
So all in 2020.
Got it. Other questions for Catherine? What are your next steps, Catherine?
That's a really good question. I've actually been in communication with Lynn Benjamin, who I was building some of this work on. And so she has been trying to get me, connect me with some of the journals that publish her work, in the sense that she feels like this might be an extension of some of the work that she's done. So that is one of the steps. I really was going to hopefully write some this fall, and I didn't. But that's on my winter spring planning here. So that, and then I've been talking to a couple people in really the Milwaukee area, but it could extend beyond that, who engage in nonprofit leader conversations. And I've talked to a couple, because all my interviews were all anonymous, but I've talked to some of the people I interviewed, and I said, if I have a chance to do this in a more public setting, would you be willing to just come and share? So they would remove their anonymity at that point. And so we've been looking for opportunities to do that at some upcoming conferences, where I could moderate a conversation between some of the people that I interviewed, because truthfully, it was really fascinating. I've been engaged in this work a long time, and just to be able to absorb the wisdom from individuals over and over was really helpful.
If you don't mind, if I could ask, Catherine, this is within the nonprofit sector, obviously. Is there a subdiscipline or a group of people or organization that has conferences around this type of work that you'd be able to tap into? And you probably know that from your literature review as well.
Yeah, so on the national level, a lot of them are funded by foundations, like the GEO conference. I'm blanking on what GEO stands for right now, but it's a connection of foundations who look at evaluation. So from there, looking at some, of the other, actually like American Fundraising Professionals and their national conference and the work that they do. So there's work that comes out of there. On a local level, it's also the universities who are guiding a lot of this conversation. American Fundraising Professionals on a local level. The Madison conference, so there's more local conferences. Was supposed to present this to Campus Compact, but that conference was canceled 2 weeks after COVID started. It was actually going to be the literature review at that point, because I hadn't done the rest of the research yet, but looking at submitting to their future conferences too.
Thank you.
Any other questions for Catherine? Well, thank you, everyone. This is, Catherine, if you have more to say, I'm just going to sign off as far as my job goes. Thank you, everyone, for being here. We are going to have some more of these throughout the year, so look for announcements coming soon. I really appreciate Catherine's time and enjoyed the presentation a great deal. Anything else that you want to say, Catherine or Bryce?
Well, I would just like to say, I think just like anyone who's done research and is trying to figure out, really is piggybacking on the last question, is if there's opportunities for this to be out in community, really in conversations at this point is my goal with it. Because I would like it to, I think this information is beneficial. but in what ways to build nonprofit capacity. So would love to have additional conversations with people, and if people feel like there's a place and a time for that, would love to do that. If you'd like to reach out, thanks, Karen is asking that. I'll put my email in the chat. That's just Catherine@lovingventi.com. And I think that would be a great way to connect. Would love to. I'm also on LinkedIn professionally on a quite regular basis. So can reach out to me there too.
And you can always reach out to the Institute, and we can definitely put you in touch with her. Want to thank everybody for coming. Encourage you to check out some things. Things are pretty quiet for the next month or two once we get through the holidays, but in the spring, look for a number of other events and initiatives, and hopefully we will see you then.
Thank you, everyone. Have a great holiday.
Thank you.